Here are the top stories for today, May 10, 2021. Improving response, the Philippines maintains a relatively low COVID-19 death rate. The country's recovery rate also reached the 1 million mark as it gears up to boost its vaccination drive. The Caloocan city government closes down a resort due for drawing mass gatherings during the celebration of Mother's Day on Sunday. No gatherings, Sulu bans activities that will draw huge crowds as Muslims are set to mark Eid'l Fitr, or the end of the holy month of Ramadan, this week. And a Filipino rower bags a ticket to the Tokyo Olympics after a good finish in a rowing competition in Japan. Good day, I'm William Theo. Welcome to the PNA Newsroom. We start with some good figures on the COVID-19 situation in the country. The Philippines continues to have a low death rate from the disease. Data from the Johns Hopkins University as of Sunday showed the country ranks 19th out of the top 20 countries most affected by the disease. The country has 16.74 deaths per 100,000 population. The mortality analysis data includes both confirmed COVID-19 cases and healthy individuals. Meanwhile, in the Southeast Asian region, the country ranks third in terms of COVID-19 recovery rate at 92.76%. The Philippines' total recoveries breached the 1 million mark on May 7. The government also continues to boost its response to the pandemic and hopes to achieve herd immunity through vaccinating the majority of Filipinos before year-end. On Saturday, over 2 million doses of AstraZeneca vaccines from the COVAX facility arrived in the country, while over 193,000 doses of Pfizer vaccines are set to arrive later tonight. More vaccine supplies are also expected to arrive this May and in the coming months. SINOPHARM is the first China-made vaccine to receive an EUA from the WHO, making it the 6th vaccine to receive the validation for safety, efficacy, and quality. WHO Assistant Director Dr. Maria Angela Simao said SINOPHARM has the potential to rapidly accelerate COVID-19 vaccine access for countries seeking to protect health workers and populations at risk. She urges the manufacturer to participate in the COVAX facility and contribute to the goal of more equitable vaccine distribution. Among vaccine brands that were approved by the WHO for emergency use are Pfizer-BioNTech, AstraZeneca, vaccines from the Serum Institute of India, and Johnson & Johnson's Janssen. The government has stocked up additional supply of remdesivir drug, which is said to be effective in easing the symptoms of COVID-19. Presidential spokesperson Harry Roque said the government will ensure that there is enough supply of the antiviral medication as preparation in case there will be a demand for it. He said that apart from the drug, the government will also ensure the steady supply of oxygen in the country. Meanwhile, 2 members of the House of Representatives stressed that the plan of the government to purchase 1 billion pesos worth of remdesivir for COVID-19 treatment is just a waste of money. Caloocan Representative Michael Defensor and House Deputy Speaker Lito Atienza said they consider this move as reckless and foolish as the World Health Organization had already rejected the use of the drug. Both Defensor and Atienza are advocating the use of ivermectin as a cheaper medicine to treat the disease. The Caloocan city government has revoked the business permit of the Gubat sa Ciudad Resort. Charges will also be filed against its owners as well as barangay officials and all guests in the area over a breach in quarantine protocols. These photos went viral on social media showing individuals swimming at the said resort in Barangay Bagumbong despite the strict quarantine protocols. According to the guidelines set by the IATF, resorts are only allowed to operate in areas under General Community Quarantine or Modified GCQ. Caloocan Mayor Oscar Malapitan has ordered contact tracing, close monitoring, and COVID-19 tests for everyone who crowded the resort amid the implementation of modified enhanced community quarantine status. Meanwhile, cases have been filed against the suspects who mauled a cameraman for documenting the event. According to police investigator J.V. Romel Vicencio, TV5 cameraman Arnel Togade was beaten by men who were allegedly guests of the Gubat sa Ciudad Resort yesterday, May 9. In conjunction with a directive to apprehend those who are not properly wearing their face mask, the Philippine National Police is coordinating with the local government units to prepare holding areas for them. Authorities say those who will be caught will be given masks and taken to designated holding areas. They will also be dealt with in accordance with existing LGU ordinances. PNP Chief General Guillermo Alcazar said violators will either pay fines or do community service. Meanwhile, Alcazar said they are waiting for the Supreme Court to approve the protocol on the proper use of body cams in their operations. He said the use of body cameras will not only improve police operations, but will also protect both the law enforcers and the people, particularly the target of search warrant. The PNP early this year acquired close to 2,700 body-worn cameras. India's daily COVID-19 death toll today dipped to less than 4,000. It earlier registered 4,187 cases and is now at 3,753 in the last 24 hours. The total toll stands at more than 246,000. The country's daily new COVID cases also went down slightly with 366,000 new cases, bringing the country's tally to more than 266 million. The decreased number of infections is attributed to lockdown implemented in regions and states of the country. India has been struggling with a deadly second wave that has severely strained its health system, leading to shortages of oxygen supplies at hospitals, as well as beds and coronavirus treatment drugs such as remdesivir. Meanwhile, in Vietnam, the country has set up 4 more facilities in Ho Chi Minh City to cope up with a major outbreak. This increases its mandatory COVID-19 quarantine capacity to more than 10,000 beds. Vietnam is also ramping up its testing capacity from the current 15,000 to 30,000 to 40,000 tests per day. The city is also preparing to treat 100 to 200 cases daily if required. Here is a look at COVID-19 figures around the world. Still to come, some parts of the country revert to the strict modified MECQ due to a surge in COVID-19 cases. And another quiet Eid'l Fitr this year as Sulu bans gatherings for the major Muslim holiday. Details ahead, this is the PNA Newsroom.
Pangalagaan ang sarili laban sa Coronavirus Disease 2019. Hanggat maaari, umiwas sa mataong lugar. Iwasang hawakan ang ilong at bibig, maging malinis sa katawan at ugaliin ang wastong paghuhugas ng kamay. Takpan ang ilong at bibig kung uubo o babahing. Umiwas sa mga taong nagpapakita ng sintomas ng coronavirus disease gaya ng lagnat, ubo at sipon. Magsuot ng face mask kung kinakailangan. Basta't sama-sama at laging handa. Kaya natin to. Isang paalala mula sa DOH, PCOO, KBP at ng himpilang ito.
Apayao is now temporarily under Modified Enhanced Community Quarantine or MECQ. This after cases in the province inched near the 1,000 mark. More on this and other news from the provinces from Marita Mawahe.
The province of Apayao has been placed under modified enhanced community quarantine from May 10 to 23. The National Interagency Task Force issued the order after the province logged a total of 982 COVID-19 cases, 60 of which are active on May 8. Quarantine measures under MECQ include stricter border control, suspension of public transportation, closure of non-essential establishments, 50% workforce for businesses that are allowed to open, and work-from-home schemes. Only authorized persons can go outside their residence subject to health and safety protocols. The National IATF has placed Zamboanga City under MECQ from May 8 until May 14. The city has a total of 7,325 confirmed cases with 5,059 recoveries, 1,994 active cases, and 272 deaths as of May 7. Following the declaration, Mayor Maria Isabel Climaco Salazar urged the public to comply with the health protocols and guidelines under the MECQ. Curfew will be imposed in all places from 10 p.m. to 4 a.m. from Monday to Sunday, and the quarantine passes will be the basis of the movement of people within the city. In Baguio City, the city government has amended its ordinance requiring the mandatory wearing not only of face masks but face shields outside their homes. The measure prohibits all persons, including tourists and outsiders, from going out without wearing face masks and face shields until the threat of COVID-19 is completely eliminated. It also prohibits transacting business with any person not wearing a face mask and a face shield in public markets, supermarkets, groceries, malls, shopping centers, and government offices. For the PNA Newsroom, I'm Marita Mawahe.
The Sulu Task Force COVID-19 has ordered the suspension of congregational group prayer and other social gatherings related to the celebration next week of Eid'l Fitr 2021. Task Force Head Governor Abdusakur Tan issued the directive following a consultative meeting Friday with Islamic religious groups, Janma Tabligh, Sulu Ulama Council for Peace and Development, and other local sectors. Tan said he was compelled to issue the order after anticipating the huge number of Muslims joining the Eid prayer. Meanwhile, Tan said Taraweeh or meditation prayer shall be allowed to continue as long as they maintain the required minimum health protocols. Eid'l Fitr will fall on May 11 or 12 depending on the sighting of the moon on Monday night, May 10. The city government of ILIGAN is targeting to vaccinate up to 95% of the city's senior citizens with the start of inoculation of the elderly against COVID-19 last May 5. More on this from Claire Gighe.
The city government of ILIGAN has started on Wednesday, May 5, the much-anticipated inoculation of senior citizens against the highly contagious coronavirus. The second priority among population groups after frontline health workers, senior citizens here began to receive the first dose of Sinovac vaccine at the designated vaccination center in Robinson's Place, Iligan. Dr. Belinda Boons Lim, Acting City Health Officer or CHO and Emergency Operations Center Health Cluster Manager, said they initially received 2,700 vaccines from the Department of Health Region 10 for the inoculation of the elderly sector.
Kita mo adjust, maghimo mi og appointment slip na equivalent sa 2,700. And then, mauday ni siya mo'y atong i-distribute sa senior citizen. Mahimo kini siya o first come, first serve. But atong yung priority pag yun, on top sa first come, first serve, ang 10 top barangay nga daghan kayo og COVID positive.
Lim emphasized that the appointment slip served as a ticket to a vaccination. This was distributed through the barangay health centers. With the appointment slip system, Lim said they were expecting to receive around 50 to 70 vaccines every 30 minutes.
O walay appointment slip, wala gyoy gi-allocate nga vaccine para ana nga tawo.
Meanwhile, the CHO hopes that around 90 to 95% of the 34,460 senior citizens registered in the master list of the city's Office for the Senior Citizens Affairs will be vaccinated against COVID-19. For PNA Newsroom, Claire Gigha of the Philippine Information Agency ILIGAN City Information Center.
The Philippine Statistics Authority is allotting special lanes for the vulnerable sector, such as persons with disabilities, senior citizens, pregnant or nursing mothers during the PhilSys registration. Since April 15, PSA Region 11 accommodated even those who were not visited for Step 1 or registration of demographic information. Previously, PSA entertained only those who were pre-registered or were visited by PSA enumerators for Step 1, mostly from low-income families. In Step 2, registrants will go to PhilSys centers for biometrics capture like iris scan and photographs of front and side view of faces. Those who receive the schedule for Step 2 through text messages will also be prioritized. Step 3 will be the issuance of the Philippine ID card. PSA 11 records show over 500,000 residents of Davao Region have already completed Steps 1 and Step 2. Up next, a Filipino rower is the latest addition to the country's Tokyo Olympics delegation. And we will tell you why indulgence in sweets is not so sweet for your health. Back after a quick break, stay with the PNA Newsroom.
Sa matinding laban natin sa Coronavirus Disease 2019, sugpuin din natin ang pagkalat ng fake news. Huwag magbahagi ng impormasyon na hindi tiyak ang pinagmulan. I-check mabuti ang source ng balita. Kumuha lamang ng impormasyon mula sa mga official channel ng Department of Health. Huwag magpadala sa maling balita, basta't sama-sama at laging handa. Kaya natin to. Isang paalala mula sa DOH, PCOO, KBP at ng himpilang ito.
You're still watching the PNA Newsroom. Two experts warned that more infectious diseases would emerge if global warming intensifies. In a webinar on climate change hosted by the Department of the Interior and Local Government, Climate Change Commission Vice Chairperson Emmanuel de Guzman warned that greenhouse gas emissions are further warming the Earth and changing the climate. University of the Philippines Professor Dr. Rodel Lasco said new studies indicate disease outbreaks are becoming frequent. Lasco said scientists connect the shortening of the interval between outbreaks to the complex interaction among virology, biodiversity, changes in the climate, poverty, food safety, and population growth. Earlier, the World Health Organization reported an apparent increase in infectious diseases, including several newly circulating ones. This increase reflects the combined impact of rapid demographic, environmental, social, technological, and other changes. The webinar oriented local government units on adapting climate change adaptation measures. Sports athletes are being lobbied for inclusion in the government's priority list to be vaccinated against the deadly COVID-19. Senator Francis Tolentino appealed to the Interagency Task Force for the Management of Emerging Infectious Diseases to include athletes as essential workers, particularly in the A4 priority of the nationwide vaccine rollout. Tolentino made the appeal as the country braces for the Tokyo Olympics from July 23 to August 8 and the 31st Hanoi Southeast Asian Games from November 21 to December 3. Philippine Olympic Committee President Pambol Tolentino earlier announced that sports tycoon Enrique Razon pledged Moderna vaccines for the Olympic delegations. The POC president also allotted a $40,000 grant from the Olympic Council of Asia for the inoculation of the SEA Games-bound athletes. In sports, Filipino rower Chris Nievares has secured a ticket to the Tokyo Olympics. In a Facebook post, the Philippine Rowing Association congratulated Nievares for qualifying for the men's single sculls in the Olympics in July. Nievares finished in 9th place overall in the men's single sculls in the World Rowing Asia and Oceania Olympic and Paralympic qualification regatta held in Tokyo, Japan last week. Nievares, a gold medalist in the 2019 Southeast Asian Games, is the first Filipino rower to compete in the Summer Games since Benji Tolentino in the 2000 Sydney Olympics. He becomes the 8th Filipino to secure a spot in the Tokyo Games, following weightlifter Heidilyn Diaz, pole vaulter EJ Obiena, gymnast Carlos Yulo, and boxers Yumir Marshall, Irish Magno, Nesty Petesio, and Carlo Paalam. And it's time to put down the sweets and start sweating. Experts said lack of exercise and decreased activity lead to obesity, which may develop to type 2 diabetes mellitus or adult diabetes. Dr. Gilbert Villela, Vice President of the Philippine Heart Association, warned that the pandemic has limited movement and healthcare access for diabetic patients. It has also increased anxiety and fear and the tendency to neglect exercise. Philippine Statistics Authority data showed that deaths due to diabetes ranked 4th in 2020 after heart diseases, cancer, and cerebrovascular diseases. Meanwhile, Dr. Michael Villa, president of the Philippine Society of Endocrinology, Diabetes and Metabolism, noted that type 2 diabetes patients have multiple risk factors such as being heavy smokers, high blood pressure, or cholesterol problems. Are you suffering from hypertension? Do you want to stay healthy and improve your condition while having fun? Experts say doing light exercises can prevent potential health problems, including those related to high blood pressure. The Association of Sports Medicine Specialists in Indonesia said exercises such as brisk walking, jogging, cycling, and swimming can help control high blood pressure. For people with hypertension, the group recommends aerobic or cardiovascular exercises. It, however, said people with hypertension must choose the right type and amount of exercise to prevent the heart from overworking and causing the blood pressure to increase. They are also advised to not exercise when they have a headache, and they must also get used to measure their blood pressure or pulse rate when doing it. People with hypertension must also record the progress of their overall health regularly. Here's another look at today's biggest stories. Improving response, the Philippines maintains a relatively low COVID-19 death rate. The country's recovery rate also breached the 1 million mark as it gears up to boost its vaccination drive. The Caloocan city government closes down a resort for drawing mass gatherings during the celebration of Mother's Day on Sunday. No gatherings, Sulu bans activities that will draw huge crowds as Muslims are set to mark Eid'l Fitr, or the end of the holy month of Ramadan, this week. And a Filipino rower bags a ticket to the Tokyo Olympics after a good finish in a rowing competition in Japan. Thank you for watching another episode of the PNA Newsroom. To check more news content, visit our webpage or head on to the Philippine News Agency's Facebook and Twitter accounts. For more stories about the government and how it serves Filipinos, look for these hashtags in all of our social media platforms and websites. We are shown on the pages of the PCOO and its attached agencies. Also, watch us on television on PTV4 and IBC 13. And that's your daily dose of the biggest news that you need to know. From the PNA Newsroom, we tell stories that inspire change. I am William Theo. Good day.